All right. So we may have some people coming in late, but we will go ahead and get started. We've got a lot of information to cover. Hopefully everybody can hear me. If you cannot hear me, please let me know. You can communicate either by unmuting yourself and just speaking up, or you can type into the chat box at the bottom of your screen and just type in any questions or comments. But certainly if there are issues with hearing me, please let me know now before we get started. So welcome to tonight's presentation. This is part one of a four-part, four-week series, Medicare 101, everything you've never wanted to know about Medicare. And tonight we're going to be talking about Medicare eligibility and coverage, including what Medicare Part A and what Medicare Part B cover. Looks like everybody can hear me. I will be pausing at the end of each section to see if anybody does have questions. And at that point, again, you can either type your question at any time into the chat box and I will address the questions as we go, or when I pause, you can again unmute and speak up and I will address your question. We've got a lot of information to get through. Hopefully everybody received the email that I sent earlier today that included the handouts and a copy of this presentation so that you could follow along with me as we go along and have the handouts that I reference as we go along. If anybody did not get that email, please let me know either by typing it into the chat box or letting me know at the end of the presentation, and I will make sure that you get those. All right, so let's get started. So again, we're going to be talking about Medicare eligibility and coverage. We are going to start with who we are though. So I am with the Pikes Peak Area Agency on Aging, which is part of the Pikes Peak Area Council of Governments. The mission of the Area Agency on Aging is to help people remain in their homes for as long as possible by developing programs and partnerships that remove barriers to independence. The Area Agency on Aging serves 3 counties within Colorado, El Paso, Park, and Teller. And basically we just bring the communities together in these 3 counties to come up with strategies and programs that help accomplish that mission. In the Area Agency on Aging, I am the coordinator for the SHIP program with Senior Insurance Assistance Department. The SHIP program, which is the State Health Insurance Program, is a program that's federally funded, and it is designed to provide unbiased, one-on-one education and information on all things Medicare and anything possibly related to Medicare to beneficiaries, family, friends, and caregivers. So over the next 4 weeks, we're going to be talking about anything and everything that could possibly be related to Medicare and becoming a Medicare beneficiary. The SHIP program within the Pikes Peak Area Agency on Aging actually serves 9 counties of Colorado. I've listed them on the slide. The SHIP program is a national program. It's a federally funded program. And so there is a SHIP program or a SHIP office available to everybody in any county of any state, anywhere in this country, typically by a toll-free number within that state. At the bottom of the slide, I've provided both our local Colorado Springs number as well as the statewide toll-free number. By calling the statewide toll-free number, you would be directed to the SHIP office closest to where you're calling from, anywhere in the state. So we are going to talk about Medicare, all parts of Medicare, including Part A and Part B, which is what we'll cover tonight. Another week, we will cover Part D, and next week, we will cover Advantage plans and Medicare Supplement or Medigap plans. But we are going to start with who runs Medicare. How do you get Medicare? So it is the Social Security Administration that it's actually responsible for determining who gets Medicare. So they determine who's eligible for Medicare. They process Medicare enrollments. So you have to contact the Social Security Administration to actually enroll in Medicare. They provide Medicare cards, the initial Medicare cards, and they are available by toll-free customer service phone number, or you can contact them at the local office here in Colorado Springs, or you can go to the Social Security website, ssa.gov. Once you're enrolled in Medicare, then Social Security wants nothing to do with it. So once they've enrolled you in Medicare, they've determined you're eligible, they've enrolled you, they've issued you your Medicare number and card, they wash their hands of Medicare. And any questions or concerns you have regarding the actual benefits of Medicare would go to the Centers for Medicare and Medicaid Services, or CMS. I will typically just refer to them as Medicare in general. Medicare is who administers the program. So it's Medicare directly that determines benefits. They process claims from providers. They pay the providers directly. Medicare is only available by toll-free number or online through their website, medicare.gov. There is no brick and mortar location for Medicare anywhere in the country that is accessible to consumers. So you can only contact them through the 1-800-Medicare number or the medicare.gov website. But they are available 24 hours a day, 7 days a week, 365 days of the year through that toll-free number. Social Security is only available by phone Monday through Friday from 7 a.m. to 7 p.m. in all time zones. So, who can have Medicare? In order to be eligible for Medicare, you have to be a U.S. citizen, and you have to be age 65 or older, having contributed into the Social Security tax system or the railroad retirement tax system in order to be eligible. You can also become eligible for Medicare at any age based on being determined disabled by Social Security. You can be eligible any age if you have been diagnosed with end-stage renal disease or kidney failure and are receiving dialysis, if you're diagnosed with Lou Gehrig's disease or ALS, and then any lawfully admitted resident alien who has resided in this country for at least 5 consecutive years is also eligible to purchase Medicare. But for most of us, it will be by turning 65 and having paid into the Social Security tax system. So, when should you enroll in Medicare? Well, for most people, initial enrollment eligibility is going to be based on turning 65. By turning 65, you are going to be given what they call an initial enrollment period. The initial enrollment period typically lasts from 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and up to 3 months after the month of your 65th birthday. That is when you are in your initial enrollment period to enroll in Medicare. However, that doesn't necessarily mean you have to enroll in Medicare or that you want to enroll in Medicare, because there are other opportunities that you will potentially have to enroll in Medicare. To enroll in Medicare, you do not have to be retired, and we'll talk about that a little bit more as we go. So Medicare, to enroll in Medicare, you're provided with enrollment opportunities. Again, the initial enrollment period is your first opportunity. Other enrollment periods that may apply. The next most common enrollment period is going to be the special enrollment period. This is the enrollment period that you would be able to use if you decide not to enroll in Medicare when you turn 65 because you are still working and have employer group health coverage. If that is the case, you are still actively employed, or you're the spouse of someone who's actively employed and you are covered by the employer's group health insurance, you can delay enrollment into Medicare, into all parts of Medicare, in favor of that active employment with group health. And once that employment ends and that group health ends, then you would have an extended amount of time to enroll in Medicare from that point based on that situation. You would get an 8-month window of opportunity to enroll in Medicare once the employment ends. Or you can enroll in Medicare at any time while you're still actively employed based on that delay. If for some reason you don't enroll in Medicare during your initial enrollment period surrounding that 65th birthday, or you're not working or you stop working, but you don't take advantage of the special enrollment period to enroll in Medicare within 8 months of the end of work, your last opportunity to enroll in Medicare would be during a general election period. A general election period is going to be every year, January 1st through March 31st each year. If you're enrolling during a general election period because you missed the other 2 enrollment periods, your coverage would not start until July 1st of that year that you enroll, and you will potentially be looking at paying some late enrollment penalties based on the fact that you didn't take advantage of the other 2 enrollment periods. And we'll talk about all of these in more detail as we go along. So this is what the Medicare card looks like. I usually refer to it as the red, white, and blue card. It simply includes your name, your Medicare ID number, which at this point in time is a random series of letters and numbers, 11 digits, and it will indicate when your Medicare Part A and Medicare Part B go into effect. And that is all it will include. Prior to 2018, Medicare cards also included your sex, male or female, and it required a signature. No longer requires either of those pieces of information. One of the most important things people tend to overlook when they're becoming eligible for Medicare is making sure that their address is up to date at Social Security. Because Social Security is responsible for enrolling you in Medicare, and in some cases you may be automatically enrolled in Medicare, depending on the situation, which we'll go over. Social Security will mail your Medicare card to whatever address they have on file, the most current address they have on file. So if you have not updated your address at Social Security for a couple of years, you may have moved, it would be a good idea to contact Social Security or go online and create a My Social Security account to make sure that your address is up to date at Social Security. Because again, they are going to mail your red, white, and blue card to whatever address they have on file, and you don't want them to accidentally mail it to the wrong address because of the potential that someone might use that card fraudulently. So just be aware of that. Also be aware that nobody is going to contact you about your new Medicare card. Social Security is not going to contact you. Medicare is not going to contact you. Nobody is going to contact you about receiving or your ability to receive that Medicare card. It just happens automatically once you enroll in Medicare. So any contacts you may get by someone suggesting that they need something from you in order for you to get a Medicare card is probably not a legitimate call. And you should either hang up immediately or you should ask them to give you a callback number and report it to either the Federal Trade Commission or to your local SHIP office so that we can report it as a potential fraud case. In the email that I sent out earlier today, I included a couple of handouts for Social Security. One was what can you do online, and it lists the different types of things that you can do at the Social Security website. And the other one was how to create a My Social Security account. Both of those documents, again, are included in the handouts email that I sent earlier today. Creating a My Social Security account on the Social Security website is probably not a bad idea. It's not required that you create a My Social Security account, but it is encouraged by Social Security. By creating a My Social Security account, it would allow you to A, enroll in Medicare online without having to go to Social Security or call them on the phone. It also allows you to see estimated benefits for retirement income. It allows you to print out temporary or replacement Medicare cards. And it just has a bunch of useful and helpful possibilities. So again, it's encouraged that you create a My Social Security account, and it can definitely make enrolling in Medicare a lot easier, but it is not required. Medicare also encourages you to create a My Medicare account. Again, encouraged but not required. A My Medicare account also can be very helpful to have. It can show you immediate information about claims and services that you've received or that have been billed to Medicare. It can keep track of a medication list for Medicare Part D purposes, which comes in awful handy during the annual open enrollment period when it comes time to review medications. It has a electronic health records component. So there's a lot of benefits to having these accounts, but again, they are not required. The other handout that I included in the email earlier today was this handout here that goes through how to create a My Medicare account. Now, the My Medicare account and the My Social Security account are two totally separate accounts. Should not be confused one with the other. Social Security account is going to require a lot more effort to set up because it has to be a lot more secure because it's Social Security, so that's a good thing. And the My Medicare account is a lot easier to set up. Simply requires creating a password and a login ID, basically. But again, can be very beneficial to have either or both of these accounts. Any questions about any of that so far? Again, if you have a question, you can either type it into the chat box or just unmute and speak up. I do have a question in the chat box. And the question is, can my coverage start before my 65th birthday month? And the answer is yes. There are a couple of ways that could happen. So if your Medicare eligibility is still based on the fact that you're turning 65 and not based on the fact that you have applied for and been approved for Social Security disability prior to age 65, if your birthday falls on the first day of a month, then your Medicare eligibility actually starts the month before your birthday month. So for example, if your birthday is June 1st, instead of Medicare eligibility starting June 1st, your eligibility actually starts May 1st, and your benefits would start May 1st if you enroll. Other than that, really the only way it could start is if you, again, were approved for disability and your coverage started before you were anywhere near your 65th birthday. So hopefully that answers that question. Any other questions on that? Okay. So now we're going to talk about the different parts of Medicare. Tonight we're going to talk about Medicare Part A and Medicare Part B. We're going to start with Medicare Part A, which basically covers your inpatient medical services. Before enrolling in Medicare Part A, there might be a couple of things you want to take into consideration. If you are already collecting a Social Security income of any kind for any reason, when you become eligible for Medicare at any age, Social Security will automatically enroll you in Medicare A and B when you become eligible. So if you are collecting Social Security income because you started collecting early at age 62, or if you're collecting a Social Security income based on disability, when you become eligible for Medicare, Social Security will automatically enroll you in Medicare A and B. If you are not collecting a Social Security income when you become eligible, for example, at age 65, then it would become your responsibility to contact Social Security to let them know that you want to enroll in Medicare. The other option might be if at 65 you are still actively employed or your spouse is actively employed and you or your spouse are covered under that person's active employer group health coverage. Again, excuse me, if you're covered under active employer group health coverage, either through your own employment or your spouse's, you would be able to delay enrollment into both parts of Medicare in favor of that active employer group coverage without penalty. And when that employer group coverage ended, you would have an extended, that 8-month window, special enrollment period to enroll in Medicare at that point. Because you're actively employed with employer group coverage, your delay would not create penalties. So you wouldn't have to worry about having to pay more by delaying enrollment in that situation. However, if you do decide to retire or you're not actively employed when you become eligible for Medicare and you don't enroll in Medicare for whatever reason, and you're not collecting a Social Security income, then you might be looking at penalties in the future if you choose to enroll in Medicare later. So that's something to keep in mind. Again, if you're collecting an income from Social Security when you become eligible, you will automatically be enrolled. If you're not collecting an income when you become eligible, it's your responsibility to contact Social Security to let them know you want to be enrolled. Or if you're actively employed or a spouse of someone actively employed covered by employer coverage, you could potentially delay enrollment until that employment ends. Any questions about any of that? Does that make sense? Not hearing anyone speak up, so I'm going to assume that makes sense. Oh, I do have a chat. I do have a question. Would I be enrolled? Would I be notified of automatic enrollment? Basically, yes, because you would, if you're going to be automatically enrolled because you are already collecting a Social Security income, your enrollment notice would basically be getting a red, white, and blue Medicare card in the mail up to 3 months prior to the month you turn 65. You would also start getting stuff in the mail from Social Security or Medicare about being eligible and getting started with Medicare, stuff like that. But Social Security would not send a specific notice saying, hi, this is Social Security. It looks like you're becoming eligible for Medicare. We're going to enroll you. They don't provide that kind of notice. They just automatically send you a Medicare card up to 3 months prior to the month of your eligibility month. And that gives you up to a 3-month window to decide if that's what you want them to do. If you want them to enroll you and want it to be effective at 65 or whenever, you would simply put the card in your wallet and everything would happen automatically from there. But it's not a specific notification, no. Excuse me. So for most people, Medicare Part A is probably going to be at no cost. In order to be eligible to get Medicare Part A at no cost, again, Social Security is the one who keeps track of this. You would have to have at least 10 years of work history of paying taxes through that work history and paying into the Social Security tax and Medicare tax. So that's the equivalent of 40 work quarters or 40 work credits. Social Security has a dollar amount for every work credit or work quarter that you can earn. So as long as you earned X amount of dollars in a quarter year, you earn 1 credit, as long as you're paying taxes on those dollars through employment. That 10 years of work history is accumulated at any point over the entire lifetime of your work history. So if you went straight from high school into private sector employment and you've worked nonstop since you were 18, you earned Part A at no cost the first 10 years of your work history. If you were a mom that stayed home most of the time to take care of the kids and worked off and on over the course of the last 30 or 40 years, as long as that off and on work you were paying taxes, employment taxes, then you could have accumulated that 10 years worth of work history over the course of those 20 or 30 or 40 years. Again, it's however you accumulate that 10 years worth of work history. Once you've accumulated it, your Part A is at no cost to you when you become eligible for Medicare. If you, at age 65, have less than 40 work quarters or less than 10 years of work history paid into the system, you could potentially still get Part A by paying for it, paying a monthly premium, For 2021, that monthly premium, it's kind of high, just for Part A would be as high as $471 a month. A little bit less in premium if you have at least between 30 and 40 quarters, but it still would be a monthly premium of $300 to $500 just for Part A. The other way you could potentially get Medicare Part A at no cost to you is through a spouse and a spouse's work history. So again, if you were that stay-at-home parent, but your spouse continued to work and pay taxes, as long as you and that spouse were married for at least 10 years, 10 consecutive years, you would potentially be able to get that Part A at no cost based on that working spouse's work history. Again, all of that's determined by Social Security. They're the ones who keep track of all that kind of stuff. And so if you're not sure if you have enough work history or if you'd be eligible to get it through a working spouse, you would need to contact Social Security directly and have them look it up for you. But they would and should be able to look it up right then and there while you're on the phone with them. So that shouldn't be an issue, and they should be able to tell you. The other thing would be by creating a My Social Security account, you'd be able to get that information directly from the My Social Security account. So what does Part A cover? Basically, Medicare Part A is going to provide any and all kinds of inpatient care. Most common inpatient care is going to be, of course, inpatient hospitalization or inpatient hospital stay. So if for any reason, any medically necessary reason, you have to go into the hospital and you're admitted as an inpatient, Medicare Part A will cover all of the cost of that inpatient hospitalization and the services that you receive while you're inpatient, except for a deductible, each and every time you're admitted to the hospital. So Medicare Part A covers all costs for inpatient hospital care after a deductible. The deductible this year is $1,184 per admission. And that covers up to 60 consecutive days inpatient in a hospital. So what that means is every time you are admitted as an inpatient to the hospital, you have to pay the first $1,484 as a deductible. Medicare Part A covers the rest, regardless of why you're there, what you need, or what it costs. And again, that covers up to 60 consecutive days inpatient. If for some reason you were in the hospital longer than 60 consecutive days, Medicare would start applying an additional coinsurance, meaning they would continue to pay everything for your continued inpatient stay after a $371 daily coinsurance this year. And if for some really unfortunate reason you were in the hospital for longer than 90 days, that coinsurance would actually go up to $742 per day, and they'd cover everything after that. After 90 days, you do start going into lifetime reserve days. So if you are looking at a hospitalization of more than 90 days, Medicare gives you an extra 60 days called lifetime reserve days. So you'd be covered up to 150 consecutive days. Fortunately, most of us will never see more than a couple of days in the hospital because they like to get you in and out pretty quick these days. So this would be in an extreme situation where you'd even have to pay attention to those kinds of expenses. For most of us, it'll be an inpatient hospitalization for a week or less. Medicare pays all costs after that $1,484 deductible. But remember, that deductible is applied per admission, not per year. So if you were hospitalized as an inpatient multiple times within a year, that deductible could be applied multiple times. Medicare defines an inpatient hospital stay benefit period as a 90 consecutive day period. In order for a new benefit period to start, you would have to have at least 60 days from the time you're discharged from a hospital before you're readmitted to the hospital before you would start a new 90-day benefit period. What that means is potentially if you are, say, in the hospital for knee surgery and then you're in there for a week. They discharge you to, say, rehab. You're in rehab for 2 days. Something wasn't right with the surgery. They have to admit you back to the hospital for whatever reason. Because there's less than 60 days from the time you were discharged to the time you were readmitted, you are potentially still in your same benefit period, and they would not apply that deductible a second time in that situation. Again, you'd have to have at least 60 days from discharge to readmission before they would be able to apply that deductible again. The same kind of discharge and readmission timeframe applies also to skilled nursing facilities, which we'll talk about next. Medicare also covers inpatient psychiatric hospital stays. However, Medicare does put a maximum amount of lifetime days that they will cover inpatient psychiatric hospitals to 190 lifetime days. For medical hospitalizations, there is no limit. They will pay for you as often or as much hospitalization as you may need for the rest of your life, with no limits. Although Medicare will cover all medically necessary services and items while you're inpatient in that hospital during that hospital stay, there are some things that Medicare Part A does not cover. For example, personal convenience items such as your own telephone, your own TV. However, these days, most hospitals, even in a shared room, you have your own TV and your own telephone. However, Medicare will not pay for you to have a private room all to yourself unless it is deemed medically necessary and ordered by a doctor, or even in a situation where there simply isn't any other space available, you would not be denied coverage for that, and you would not have to pay that private room rate. No part of Medicare, A or B or D, covers any of the first 3 pints of blood someone might need as a transfusion. Don't ask me why. I've never gotten a straight answer from Medicare as to why they will not pay the first 3 pints of blood. Starting at pint number 4, Medicare covers blood, but the first 3 pints of blood are not covered. Medicare Part A does not cover private duty nursing while you're in the hospital or a room sitter, and it does not cover what's considered self-administered drugs. Basically, self-administered drugs would only fall into the scenario on, say, the day of discharge. During the day of discharge, no matter how long it may take them to discharge you from a hospital, the day of discharge is not considered an inpatient day. So you're not technically still an inpatient if you're being discharged on a given day. However, if they are taking forever to discharge you, and it comes time for you to take maintenance medication, like high blood pressure medication or whatever you've been taking, and they come to you with a cup of pills to give you those maintenance medications so that you don't miss them, because it's still going to be a couple hours before they get you out of there. If you take that cup of pills and you swallow them, you just self-administered medication. And they could potentially bill you retail or private price for that amount for those medications. Again, not something that happens very often, but something to be aware of. If you're being discharged from a hospital and it's taken extra long time, I wouldn't necessarily suggest that you just take whatever they hand you. I would suggest that you ask questions and find out more about what they're trying to give you, so that you're not surprised billed for that and not realizing it. Again, another part of Part A benefits is skilled nursing facility. Basically, skilled nursing facility is going to be for rehab after a hospital stay, rehabilitation after a hospitalization. And in fact, Medicare does require that in order for them to pay for a skilled nursing facility stay, you have to have at least 3 days inpatient stay in a hospital prior to being discharged to a skilled facility before Medicare will pay for the skilled facility. So basically, you have to be in the hospital as an inpatient for at least 3 days or longer before you're discharged to a skilled facility for rehab or recovery. Otherwise, Medicare will not pay for that skilled facility for rehab or recovery. However, as long as you meet that 3-day inpatient stay criteria, the requirement, your stay in that skilled rehab for recovery or rehabilitation, Medicare will pay 100% for the first 20 consecutive days in that rehab facility. So the first 20 days, Medicare pays 100%. Starting at day 21, Medicare will continue to pay everything for that inpatient rehab stay, except for a daily coinsurance. This year, that daily amount is $185.50 per day. And they will continue to pay everything except for that $185.50 per day up to a maximum of 100 days. So again, Medicare pays the first 20 days of a rehab stay at 100%. The next 80 days, they pay everything except for $185.50 per day. Medicare Part A pays all or part of up to 100 consecutive days in a skilled facility for rehab or recovery. That 100 consecutive days is considered a benefit period, and you get an unlimited number of benefit periods for this benefit for the rest of your life. In order to start a new benefit period, again, you would have to have that 60 days from the time you're discharged from one stay before you're readmitted for a second stay before a new benefit period would start. So for example, if you are on a ladder trying to clean the gutters and you fall off the ladder and break your right leg, and you have to go to the hospital, doctor puts a cast on the leg, you're in the hospital for 3 or 4 days, doctor sends you to rehab for rehabilitation, get some therapy in that leg so that it heals properly. You're in there for 5 or 6 weeks. You're discharged home. 6 months later, you're up on the ladder again and you fall and break your left leg. And you have to go through that whole process all over again. When you're admitted to both the hospital and the rehab facility the second time, because there's been more than 60 days between discharge and readmission from the first time, you start a new benefit period for those services. Less than 60 days between discharge and readmission, you go in where you left off on the same benefit period. Medicare, again, will pay all or part of up to 100 consecutive days in this situation. However, if you're still in a skilled facility for any reason, on day 101, Medicare no longer cares why you're there. Because as of day 101, Medicare will start considering your continued stay in that facility as a custodial or long-term care stay. And Medicare, unfortunately, does not cover long-term care, facility care. The key to Medicare coverage is medical necessity. Medicare will typically always pay any service that is considered medically necessary for any reason, anywhere. However, if it's a service that they consider custodial, it's not going to be a benefit of Medicare. So Medicare pays all or part of up to 100 days at a time, and they pretty much have determined that if you have not gotten well enough to go home after 100 days in a facility, if you're not well enough to go home on your own, even if it's with continued rehab at home that they will pay for, if you're not well enough to go home after 100 days, then the likelihood of you being well enough to go home anytime soon is pretty small. And that's why at 101 days, they stop coverage altogether, completely, and they start considering that continued stay long-term care or custodial. And at that point, you would be looking at privately paying for that continued stay in the facility, or potentially you have purchased long-term care insurance that would help cover that continued stay, or potentially you could qualify for Medicaid to help pay for that continued stay. But the bottom line is Medicare would not continue to pay for your continued stay in a long-term care or skilled facility for any reason. The last benefit of Medicare Part A is home health care and hospice coverage. Home health care benefits through Medicare Part A will provide, again, medically necessary services in your home. The care has to be certified by a doctor. So a doctor has to tell Medicare that you meet the eligibility criteria for Medicare to pay for in-home health care. If Medicare criteria is met, then deductibles do not apply to this benefit, and most services are covered at 100%. And there is typically no limit to how long you can receive in-home health care under Medicare, as long as that care is either continuing to improve your health or it's maintaining your health to allow you to stay independent at home. The only exception to that benefit at 100% would be if that home health care agency provides you with some durable medical equipment or DME. So for example, if the home health care agency says you need a wheelchair and they arrange for you to get a wheelchair delivered to your home, Medicare will pay for that wheelchair, but not under the home health care benefit. It's considered a different part of Medicare, and Medicare only would pay 80%. You'd have to pay the other 20% for that wheelchair. For the hospice benefit, or end-of-life care benefit through Medicare is a benefit that will pay for pretty much any services that you receive while you're in your home that are designed to make you comfortable in an end-of-life scenario. An end-of-life scenario is usually defined as an expectation to live of 6 months or less. However, that does not mean you have to die in 6 months or less. And as long as your health situation continues to meet that potential life expectancy of 6 months or less, you could potentially be on hospice for a very long time. It just really depends on the situation. Again, it has to be certified by a doctor on a regular basis, every 60 to 90 days for Medicare to continue to pay for those services, but those services would be covered at 100%. Medicare would also pay for those services if you are in a facility, but Medicare does not pay for room and board. So they would not pay for you to be in the facility, but they would pay for the hospice services that you receive while you're in the facility. Again, 100% coverage, no limit to how much service or how long service can be received, as long as you continue to meet the eligibility criteria as certified by a doctor. So that is basically Medicare Part A in a nutshell. Any questions about those benefits? I see I do have a question in the chat box. I applied, I'm assuming for Medicare during the initial enrollment period, got approved, and then got an IRMA notice that I have to pay extra per month only for Part A, and told that I will have another IRMA if I apply for Part D, but my employer contribution for medical and drug is close to $600 per month. So IRMA, and we will talk about this, I think, during the next section as to what IRMA is and why it potentially makes you pay more. So let's just go to the next section where we talk about Part B, and we'll cover the IRMA a little bit more. So give me just a little, and if I don't answer your question by the time I'm done with Part B information, let me know. Any other questions about Part A? Okay. So that was Part A in a nutshell, basically covers your inpatient services. Part B of Medicare is basically going to cover your outpatient services. Again, things to take into consideration before enrolling in Part B. Again, if you're already collecting a Social Security income for any reason of any kind, you will usually automatically be enrolled in Medicare Part B by Social Security. Again, if you are still actively employed or your spouse is actively employed and insuring you, you can delay enrollment into both parts or all parts of Medicare until that employment coverage ends. For Medicare Part B, everybody pays a premium. So most of us will have earned Part A at no cost one way or the other, but regardless, everybody pays a premium for Medicare Part B. But as it notes on the slide, that amount of premium can depend on income. There are some situations where you might want to have Part B, or you might need to have Part B. Depends on how you look at it. So sometimes you would have to have Part B if you want to purchase or have additional coverage when you have Medicare. So if you have Medicare Part A, but you don't get Medicare Part B, you cannot enroll in a Medigap or Medicare supplement policy. You could not enroll in a Medicare Advantage plan. You have to have both A and B of Medicare to enroll in either of those options. If you are retired military and are eligible for TRICARE, once you become eligible for Medicare, TRICARE does require that you enroll in Medicare A and B if you want to retain TRICARE benefits in any way, shape, or form. So even if you are actively employed, has always been my understanding, you would also have to enroll in Medicare. However, I did just recently learn that if you are a TRICARE beneficiary, but not using TRICARE in favor of active employer coverage, you delay enrollment in Medicare because of the employer coverage. You can delay enrollment in Medicare, which can delay enrollment in TRICARE, and there wouldn't be any issues with TRICARE. However, if you're not actively employed and using TRICARE when you become eligible for Medicare, you must enroll in Medicare or you lose TRICARE benefits altogether. When you enroll in Medicare, TRICARE turns into TRICARE for life. And between Medicare and TRICARE for life, you would not need any other coverage, period. If you are a veteran, and I get this question from veterans a lot, as to whether or not they should enroll in Medicare Part B if they use the VA system as their primary care. And my answer is always, it's up to you. VA is not considered medical insurance. VA is a program. So Medicare and VA do not coordinate with each other. And VA is not considered a good enough reason for not enrolling in Medicare during your initial enrollment period without penalty. So if you become eligible for Medicare, but you use the VA system for most of your care, you prefer to use the VA system, you don't see any reason to enroll in Medicare or pay the premium for Part B, and you choose not to. If for some reason in the future, down the road, you decide that having Part B might be a good idea for some reason, and you go to enroll in Part B, you would have to enroll during the general enrollment period, and you would probably pay penalties for late enrollment for not enrolling when you first became eligible. So if you don't enroll in Part B and you're a veteran when you first become eligible during that initial enrollment period, you're not actively employed, you would be looking at penalties down the road to your Part B premium. Again, and I go over this and I repeat this over and over and over in the hopes that it sinks in, because there's a lot of confusion surrounding active work and enrollment into Medicare. If you are actively employed or the spouse of someone who is actively employed and covered under the employer group health benefit, you can delay enrollment into both parts of Medicare. You can enroll in Part A and delay Part B. You can delay A and B. You can enroll in A and B. But if you choose to delay enrollment into Medicare, you will not be penalized as long as you are actively working with that employer group coverage, either your own work or your spouse's. And when that employment ends, you would have this special enrollment period that gives you an extended amount of time to enroll in Medicare after the fact without penalty. And then, of course, if you miss both of those, you have the general enrollment period. For Medicare Part B in 2021, the base monthly premium this year is $148.50 per month per person. Typically, if you're collecting a Social Security income or even a railroad retirement or federal pension, that premium is automatically deducted from that income every month. If you are not collecting one of those incomes, but you enroll in Medicare and you have to pay that premium, you would have to pay that premium directly to Medicare or Social Security, and they would bill you directly, or you could arrange to have it electronically withdrawn from a bank account every month. But as long as you're collecting an income, they will be automatically deducted. If you're not collecting income, they will bill you, or you can arrange to have it just deducted automatically each month. Late enrollment penalties, for those who may at some point incur a late enrollment penalty because you did not enroll during the initial or have a special enrollment period. The way the Part B penalty works is they will charge an extra 10% for every full year, every 12-month period that you were not enrolled in Medicare beyond your initial enrollment period. That 10% is accumulative. So if you wait 5 years to enroll in Medicare, you're looking at 10% times 5 years, or 50%. They're going to take that 50% penalty, multiply it by whatever the premium is 5 years from now, and whatever that comes out to is going to be tacked on top of that premium 5 years from now. So you're going to pay 1.5 times the premium forever. Keep in mind that the Part B premium does increase a little bit every year for everybody. And so as time goes on, that amount gets higher and higher. The penalty that they tack on, in this example at 50% because it was 5-year wait, that 50%, whatever amount they calculated that 50% penalty to be when you enrolled in Medicare, that amount will always stay the same. But it will always be tacked on to the monthly premium every month for every year, even as that premium increases. And again, that penalty lasts forever, every month, forever and ever and ever. It never goes away. So the longer you wait, the more you're going to pay. Ultimately, the less advantage there is for you to wait. Part B premiums are also what's called means tested, and this is where IRMA comes in. What means tested means is that Part B premiums are now based on income, meaning the more income you have, the higher Part B premium you could pay. Means tested premiums are going to be based on the most complete income tax filing that Social Security can get their hands on. So we're talking completed tax years. Right now, that most completed tax year is potentially, and I need to change the slide, potentially 2019. So if you had a much higher income in 2019, and that's the most complete IRS tax filing that Social Security can get their hands on to look at, but in 2021, your income is cut in half and you are no longer at that high income earning level, you may still get a notice in the mail from Social Security that says your income is this high, you're going to have to pay more in Part B premiums based on the income related monthly adjustment amount. That does not mean you're necessarily going to have to pay that higher premium if your income has become less. And we'll talk about that more in a second. For Part B services, Medicare does have a deductible for all Part B services. It is an annual, one time a year deductible, $203 per year. Again, this deductible, like all parts of Medicare, can increase every year. So for example, last year, the deductible for Part B was $198. This year, it's $203. Next year, it will be a little bit more. However, it's $200. It's a drop in the bucket compared to most deductibles these days. Once that deductible is met, again, it's a one-time a year deductible. Once that deductible is met, Medicare pays for most Part B services at an 80-20 split. They pay 80, you're left with a balance of 20% of the cost of that service. So more on the IRMA. IRMA income adjustments are based on higher income earners. For individuals, the income limit is around $88,000 per year. For a couple filing jointly, the income limit is $176,000. That is the threshold. Anything below those numbers, you don't have to worry about paying higher premium. If you're at or above those numbers, you may end up having to pay a higher premium. So if you are 88,000 or higher, up to 111,000 per year as a single person, you may pay an additional $59.40 per month on top of the $148.50 Part B premium. And it goes up from there based on income thresholds that we see on the slide here. But again, if your income is at those numbers, those minimum thresholds or less, you do not have to worry about paying the higher Part B premium. You will pay the $148.50 base premium. And again, if you had a higher income 2 years ago when Social Security is looking at your income and tax records, but in the meantime, that income has been reduced below the threshold, you're still probably going to get a notice saying you have to pay a higher premium, but that does not mean you can't appeal that and prove to them that that income is no longer at that high level. And as long as you can prove to Social Security that your income is no longer at that high level, they will not charge you that higher Part B premium. So even if you have to pay that higher Part B premium at 65 when you become eligible because you're still working, or you still have income that puts you at that higher tax bracket, if at any time down the road that changes to put you under that limit, you can let Social Security know that so that they stop charging you that higher premium. So just because you're given that notice and you may have to pay that higher premium does not mean that is forever and ever. What you have to pay fluctuates with your income if it fluctuates as well. So I'm going to address a couple of quick questions here before we move on. So hopefully that answered the question about the IRMA. The same logic and income limits do apply to Part D. The income limits are going to be the same for Part D. The amount that you have to pay above and beyond the base Part D premium obviously are going to be much lower because the premiums for Part D can be much lower. We will go into that in more detail on week 3 when we talk about Part D in detail. But it does apply to Part D as well. Regardless of what employer contribution may be, hopefully that is in the form of reimbursement or a savings account. It's great that you have that employer contribution, but that doesn't exempt you from having to pay that Part B IRMA amount. Again, if that doesn't answer your question, please let me know. The next question, what's the difference between Medigap and Advantage Plan? We will go into significant detail between Medigap and Advantage plans next week when that's all we talk about. So hopefully I'll have you attend next week and we can go into that in detail. Let's see. What effect would there be if you retired but were able to continue the employer coverage for you and your spouse? So this is a good question. If you continue to use the employer health benefits, even though you're retired and you become eligible for Medicare, as if you are not actively working and that employment health coverage is through active employment, it is not considered good enough coverage to delay enrollment in Medicare. So if you're covered in retirement benefits, that's wonderful. You may be able to keep those retirement benefits. But if you don't enroll in Medicare in favor of those retirement benefits and you try and enroll later, you will be penalized and limited to when you can enroll. So the key to that delay enrollment into Medicare is you have to be actively employed with employer group coverage, or a spouse of someone actively employed covering you under their employer group coverage. The key to that whole situation is active employment. Retirement and health coverage is great. You may be able to keep it, may become secondary to Medicare once you enroll in Medicare, but it would not eliminate penalties if you delay enrollment into Medicare in favor of that coverage. And then the last question I'll address real quick, and then we'll save the rest for the end, is will Social Security automatically take premium in 2 years when I start to draw? So if you become eligible and enrolled in Medicare prior to collecting a Social Security income, so say you turn 65, but you want to wait to collect Social Security until you reach full retirement age of 67 and whatever, 67 and some months or 66 and some months. And while you're not collecting income, again, you're going to be paying that premium directly. As soon as they start cutting you a check, they will start deducting that premium automatically from that check. So yes, it will be automatically deducted once they start cutting you a check from Social Security. In the meantime, you pay them directly. Once they start paying you, it comes out directly. So we're going to move on, try and wrap this up. I will address the rest of the questions after this next section, so be patient with me. We're already running over time, so I apologize. So we've talked about what it costs. We've talked about whether or not you should enroll in it. Let's talk about what Medicare Part B covers. Again, basically Medicare Part B is going to be outpatient services. So the most basic way to put Medicare A and B is Medicare A is inpatient, Medicare B is outpatient. Under outpatient services, that covers any and all kinds of doctors or office visits, primary, specialist, whatever. Covers all your lab and x-ray services, covers all medical, surgical, and anesthesia services, and Medicare will pay for second medical opinions. Again, no part of Medicare covers the first 3 pints of blood someone might need, but Part B will start covering blood at pint number 4. Part B covers emergency ambulance transports, covers your annual vaccines, including the flu shot, excuse me, the pneumonia shot, and the shingles vaccine. Covers all your outpatient physical therapy, occupational therapy, and speech therapies. Again, covers the durable medical equipment. That includes oxygen, wheelchairs, walkers, hospital beds for in-home. And there is some limited coverage for other services as long as they're deemed medically necessary, such as podiatry and chiropractic. Things not going to be covered by Medicare Part B, routine physicals. So if you're used to getting a routine annual full physical, like maybe you got while you were in the military, where they hook you up with electrodes, they put you on the treadmill, the whole 9 yards, Medicare doesn't cover that. Nor does it cover routine foot care, hearing aids or the fitting of them, does not cover routine eye exams or the glasses associated with eye exams, and even with medically necessary covered eye services, Medicare does not pay for refractions of the eye. Currently, Medicare does not cover dental in any way, shape, or form, period. And it does not cover anything that would be considered cosmetic or not medically necessary. Now, having said all that, what I can tell you is that with Medicare, there tends to be exceptions to a lot of rules. So Medicare does not cover routine annual physicals. What Medicare will pay for when you first become eligible is what they call a Welcome to Medicare preventive visit. This is basically not a physical. What it is basically going to be an in-depth conversation with your provider, and they're going to go over your medical history, your family's health history, your social history, your mental health history. They're going to do an in-depth review of your history. The result of that in-depth review, that in-depth conversation, is that that doctor may potentially suggest preventive services for the near future to help keep you healthy. The Welcome to Medicare preventive visit is a use it or lose it benefit. So once you are eligible and enrolled in Medicare, you have 12 months to use or lose this benefit. Regardless of whether you use it or lose it, you are still entitled every year to a wellness review. Again, a wellness review is going to be an in-depth conversation with your provider about the previous year's health history, medical, mental, social history. And it may result in that provider suggesting preventive services for the near future for the coming year. Medicare did jump on the preventive service bandwagon when that was becoming en vogue and very popular with all insurances, because they did determine finally that it does become more cost effective for them to help prevent illnesses instead of just treating them after the fact. So Medicare covers a huge wide range of preventive services. All preventive services are now covered at 100% by Medicare. And the list of services that Medicare covers as a preventive benefit continues to grow every year. I've listed a bare minimum 3 preventive services covered by Medicare. If you want a complete listing of all the services Medicare covers at 100% as a preventive benefit, the best way to find that information is to look in the Medicare and You Handbook. You can get the Medicare and You Handbook in 2 ways. You can either go to the Medicare.gov website and download it as a PDF or simply view it on their website, or you can call 1-800-MEDICARE and ask them to mail you one. For people just becoming eligible for Medicare this year, you may or may not automatically get a hard copy Medicare and You Handbook in the mail sometime in September or October, because you're just becoming eligible and new to Medicare this year. But every year after this, you should automatically get a hard copy Medicare and You Handbook in the mail, as long as your address is up to date at Social Security. In the Medicare and You Handbook, there's about a 25 or 30 page section that details all of preventive services Medicare pays for. It details other services and describes other services Medicare pays for. So if there's a little blue apple symbol next to the description in this handbook, it would be indicative of a preventive service. But that is the most effective way and the most informative way to get a full list of all preventive services Medicare now does cover. And again, all preventive services Medicare pays for at 100%. Going back to this list, again, Medicare does not pay for routine physicals. They pay for that preventive service. Routine foot care, Medicare does not pay for someone to go to the podiatrist that simply doesn't want to cut their own toenails. However, if you are diabetic, if you are diagnosed with pulmonary vascular disease, those would be medically necessary reasons for you to see a podiatrist for foot care. Medicare would pay for that. Hearing aids or the fitting of them, there's not any exceptions to that rule. They're simply not covered. Routine eye exams. So if you're going to the optometrist to see if your prescription has changed and if you need new glasses, Medicare does not pay for that. It's considered routine or not medically necessary. However, if you are developing cataracts, glaucoma, poke yourself in the eye with a pencil, those would all be medically necessary reasons to see an eye doctor. Medicare would pay for those medically necessary services. Again, no exceptions for dental care at this time, although dental care is being discussed at a federal level, so we'll see if what the future holds. And then cosmetic surgery or anything not considered medically necessary would not be covered by Medicare. Anytime you're in a situation where you're not sure if Medicare is going to pay for a service that the doctor is suggesting that you may need, don't be afraid to ask the doctor if Medicare will pay for that. It's the doctor's responsibility, quite frankly, to tell Medicare that it was a medically necessary service so that Medicare does pay for that. If the doctor hesitates or implies that he's not willing to tell Medicare it was medically necessary, then you need to hesitate as to agreeing to whether or not to get that service and ask the doctor to explain why. Again, it's the doctor's responsibility to tell Medicare services were medically necessary. So again, don't be afraid to ask the doctor if you're not sure if Medicare will pay for something. So that is Part B in a nutshell. Part A, inpatient, Part B, outpatient. There are some financial assistance programs available for people who have limited and low incomes that can help pay the Medicare Part B premium. They are called Medicare savings programs. These are federally funded programs that apply to anybody with Medicare. And these programs can help pay the Medicare Part B premium if you qualify. It may also, depending on income and asset level, may also help cover other Medicare A and B costs, such as the A and B deductible and potentially the co-insurances associated with A and B. If you qualify for any level of Medicare savings program, it does automatically also come with financial assistance for drug coverage for the Part D and reduces all of those costs as well. This is a federal program because Medicare is a federal program, so the assistance is federal level. However, the federal government has determined that the best way to apply for these programs is at a local level through the local Department of Human Services. So basically it becomes a Medicaid application, even though technically it is not a Medicaid program. If you are already on some specific programs, you would not need to apply for this. It would become automatic. So if you are on SSI, if you are on OAP, or if you are applied for and approved for long-term care Medicaid of any kind, you would automatically get this assistance of Medicare savings and the Part D assistance, which we will talk about in detail on week 3. But because this is financial assistance, it does have income and asset limits that you would have to fall under in order to qualify. For 2021, these are the income and asset limits. The dollar amounts are monthly income for a single person or a couple, and those amounts are in gross dollars, meaning pre-deduction dollars. So if you are on Social Security only, and currently Social Security deducts $148.50 from your check, you would have to add that $148.50 back in for your total income to see if you fell within these limits. Also has asset limits, which are indicated at the bottom here. Asset limits do not include your home, your vehicle, your personal possessions. What they're going to look at for assets is property that you don't live on. They're going to look at RVs you may have sitting in the driveway. They're going to look at bank accounts, investments, that kind of thing. But they're not going to look at your home. They're not going to look at the property it sits on. They're not going to look at your primary vehicle or your personal possessions otherwise. If you want more information about these programs, we do help with these applications as well. And so anybody who is interested in more information or wants to apply, please feel free to contact me. My contact information will be at the end here in a second. And we are always happy to help with these applications or even answer any additional questions you may have. So we're pretty much wrapping it up. Again, if you have questions, please don't hesitate to contact your local SHIP office. For our 9-county region, that is us, and we are happy to help. For anybody outside of our 9-county region, you can always direct them to the shiptacenter.org to find the SHIP office closest to them if they are in another state. Our office also houses the Senior Medicare Patrol Project, which is a program that's designed to help people understand, identify, and report fraud and abuse, Medicare and Medicaid fraud and abuse or errors. We are always looking for volunteers to help with education and outreach, and it can be really interesting thing to volunteer for. So if you'd like more information, you can give us a call, or you could go to the smpresource.org website for more information on the SMP program. Again, we are always looking for volunteers. We are a not-for-profit. We survive on government grants, but that does allow us not to have to charge for our services. So volunteers are always welcome, and it can be a very interesting and rewarding experience. And that is it. So we are going to take some questions now. I'm going to leave my contact information slide up while I answer some questions. And again, if you do have questions you want to ask live, you can simply unmute and voice them. So I'll take some more questions from the chat. Next question is your actual birth date of the month considered your enrollment date. 3 months in advance of birth month, or is it the first day of your birthday month? For instance, date of birth, January 28th. Okay, so again, unless your birthday is on the first day of a month, your Medicare eligibility always starts on the first day of the month. If your birthday's on the first day of the month, you actually get to start a month before, but it's still the first day of the month. So it doesn't matter what day of the month your birthday is, your benefits become effective the first day of that birthday month at the earliest. Next question, can the insurance that is provided by your current employer drop you because you are turning 65 and become eligible for Medicare? Absolutely not. Nor can they encourage you to drop them in favor of Medicare, nor can they pay for you to enroll in Medicare, such as pay your premium for Medicare. If you are actively employed with employer group coverage and you work for an employer with at least 20 employees, they cannot take Medicare into account at all. They have to continue to insure you as a regular employee, regardless of Medicare status, as long as you are actively employed, period. So again, they cannot encourage you to drop their coverage in favor of Medicare. They cannot incentivize you to enroll in Medicare by offering to pay for it. Nothing like that. Now, if you work for an employer with less than 20 employees, it may be a different story, because employers with less than 20 employees, if you do not enroll in Medicare, that employer coverage may not pay as well. And considering the cost of the employer coverage for a smaller employer, it may not be cost effective to you. But employer coverage, whether you enroll in Medicare with 20 employees or more or 20 employees or less, when you enroll in Medicare, if you have more than 20 employees, Medicare becomes secondary if you enroll while still working. If you have less than 20 employees, it becomes primary if you're still working and enrolled in employer coverage and Medicare. It can get kind of complicated when you start going into the weeds like that, but the bottom line is no, they can't do that. Next question is, well, I guess that was all questions, just other comments. So thank you for your comments. I appreciate it. Any other questions before we wrap it up? Again, like Jessica mentioned in the chat, this meeting has been recorded. This presentation has been recorded, and it will be posted to our webpage at ppacg.org. Probably before the end of the week, before the end of business tomorrow, hopefully, depending on how quickly Jessica can get to it. But it will be posted in the next couple of days so that you can view any or all of it at your leisure. It basically is a YouTube video. And if there are no other questions, I will let you all go for tonight. I appreciate you joining us tonight, and hopefully you learned a lot. Again, my contact information, you're welcome to email me with other questions later if you think of them after we leave this meeting, or at any time in the future. I'm happy to answer any questions at any time. We are currently taking appointments only, so we can see people in person if required. We can do Zoom appointments. I have 5 counselors and a part-time volunteer, so we are more than happy to meet one-on-one with anybody to talk about your specific situation in office or online, whatever is most comfortable for you. Or give us a call at our local Colorado Springs number or the 888 number. Or again, you're welcome to email me at seniorinsure@ppacg.org, and I will respond as quickly as I can. Otherwise, again, thank you for joining us. If you have any questions, let us know, and hopefully I will see you all next week. Have a great night.